Hi, my name is Erica Bernal, and the genetic disorder I researched this semester is Down syndrome. So, what is Down syndrome? Down syndrome is when there's an extra copy or piece on chromosome 21. So, instead of having two chromosomes, they end up having three, and this ends up affecting their physical and mental health. Another common name is trisomy 21. If you didn't hear about Down syndrome, you may have known it as that name, trisomy 21. So who's affected by Down syndrome? About 5,100 babies annually in the United States are affected by Down syndrome. I broke it up into a couple categories of ethnic groups that are most affected. Currently, non-Hispanic and white is the category most affected with 67%, and then the second most affected is 16% being Hispanic. Women that are 35 years and older are also at highest risk, and then the way an individual takes care of themselves during pregnancy and how much support they receive is also another factor that affects if they have a child with Down syndrome. Some phenotypes, I put some pictures up of what individuals with Down syndrome usually look like, but some characteristics are like small heads, large tongues, abnormal ears. They usually tend to have flat heads. And then health problems that could arise are like heart problems, and that's usually seen at birth. Sleep apnea, usually individuals with Down syndrome end up using CPAPs. And then other chronic infections that they end up having are like ear infections and then eye diseases, and they end up needing some special support for those things. Inheritance. So Down syndrome is actually not inherited, rather it's a mistaken cell division. So this is when an individual has three chromosomes on 21 instead of two, and it's not even caused by the sperm or egg. It just happens. Non-Mendelian genetics. So three that I'll be looking at are expressivity, lethality, and then pleiotrophy. So for expressivity, each individual that has Down syndrome, it varies how severe their case is. Some individuals have, for example, more health defects than others, like heart defects, or their growth is different. It just varies from individual to individual. And then as far as lethality, some survival rates are just so low for individuals with Down syndrome, and this is actually another reason why their lifespan is so short. Usually they live up to their 60s if they're lucky, or they just die at birth, which is very rare, but in some cases does actually occur. And then pleiotrophy, the extra chromosome on 21 is the main reason for this genetic disorder, and unfortunately because of this genetic disorder, it causes other traits to be affected. So mutations, like I said previously, it just happens due to cell division. There's not really much research to tell us why this occurs, but there are things that can help back us up on ideas of where cell division kind of goes wrong, and I'll be talking about that in the next slide, and this is also known as non-disjunction. So the three that we'll be looking at is like complete trisomy, mosaic trisomy, and then translocation trisomy. So to begin with, complete trisomy is when there's just an error in the formation of the egg or sperm. There's not really a reason to tell which one it really comes from. Like I said previously, it just happens. The extra chromosome just gets carried somewhere during cell division. And then mosaic trisomy is when a normal egg and sperm unite, and that usually happens really early in the development of a fetus. And then translocation is just when part of a chromosome gets passed on, and this can either show up generations later. It doesn't necessarily mean just because you carry that extra piece of chromosome that you'll have Down syndrome. Usually that's seen later in life with your grandkids or great-grandkids, and so forth. And that one is the most rare. So diagnosis, I put a couple on here of how usually Down syndrome is diagnosed. Going through them, amniocentesis is when there's an examination of the amniotic fluid. As you can see, there's a picture on the slide that shows what that might look like. And then CVS is when there's an examination of the placenta. Currently, the most common ones are ultrasound and blood test. Those are usually where Down syndrome gets diagnosed at. And then in some rare cases, unfortunately, they don't get diagnosed during pregnancy, women, and they find out at birth because of those phenotypes we spoke about earlier. Treatments, there's not currently a treatment that can necessarily fix Down syndrome or prevent it, but there are some treatments that help individuals better their diagnosis, and these are physical and occupational therapy, speech therapy. Some individuals end up going to special education, so they get help on areas that others may specialize in, and then some have to get home or assisted care, and unfortunately sometimes these individuals have to go into the care of others, such as nursing homes, just to receive extra help, because it's sometimes, in some cases, it's very hard to manage behaviors and be able to help an individual fully. And then here's some more ways that individuals with Down syndromes get treated. Sometimes they have to go into surgery, or they get specific prescriptions for their health. They get assisted devices. And like I said previously, sometimes therapy is the best one. And here's my works cited. Thank you.